Okay. Fifty by five. Sir, shall we start by 7:10?
Yeah, start பண்ணிடலாமா? 7 இன்னொரு 3 minutes we'll wait. 7:05
Okay.
we'll start the introduction and then we'll go.
Okay, sir. Okay. Hi, good evening, everyone. I believe my audio and video is clear. A warm good evening to distinguished doctors, respected hospital owners, healthcare administrators, medical entrepreneurs, industry leaders, faculty members, students, and honored guests. I'm indeed very happy on welcoming you all on behalf of Medverse, MedTalks, SIHAM, and the Association of Physicians of India, Salem chapter. I extend a heartfelt welcome to each one of you. As we all know, every generation of doctors has witnessed one breakthrough, like the stethoscope, X ray machines, ultrasound, MRI, the internet, electronic medical records, and today it is artificial intelligence. We all have a misconception that today AI is replacing everyone's work, which is not actually true. And it is not here to replace the doctors. So it is actually here to empower them and to save their valuable time. AI actually supports them by reducing their repetitive work and to make informed decision, which is ultimately resulting in spending more quality time with patients. And today, artificial intelligence is changing the way we diagnose, the way we communicate, the document, research, educate, and care for patients. So, therefore, the question is almost no longer will AI impact the healthcare, but the actual question is how can every healthcare professional start using the AI effectively? So, to answer all this question, we are very privileged to have with us someone who combines clinical excellence with entrepreneurial vision, a physician who believes healthcare should continuously evolve through innovation, the founder and CEO of Medverse, the founder of Pharmacy Express, a consultant physician at Sims Chellam Hospital and Venus Life Care Clinic, an organizing secretary of Tapicon 2024 Salem, Honorable Secretary API Salem Chapter, and an enthusiastic faculty at Apicon Partner 2026, who is none other than Dr. Arun Vijay. Through Medverse, he has created an actionable platform that connects doctors, hospitals, startups, medical manufacturers, investors, and healthcare leaders to shape the future of excellence. And therefore, today he will be sharing with us the practical insights of how AI can become an everyday companion for every doctor, not tomorrow, but starting from today. Thank you. Over to you, Dr. Arun, sir.
Thank you. Thank you. Okay. Okay. Good evening, everyone. Sir, good evening, Dr. Rohit Shah. So I think my audio is clear. Hope my audio is clear. Are you able to see my slides? Okay, sure. Good. Thank you so much. So let me begin with a short story. Okay, ஒரு குட்டி கதையோட ஆரம்பிக்கலாம். So when the Titanic struck the iceberg, many passengers initially refused to board the lifeboats because they thought the Titanic was an unsinkable ship. So such magnificent and seemingly unsinkable something like the Titanic could actually sink. They couldn't believe that. So as a result of that, several lifeboats initially left with far fewer passengers than they could accommodate. So from this, history teaches us one greatest danger is that it's not the crisis itself, but our inability to recognize and adapt to change. Today, artificial intelligence is taking the world by a storm. Whether we like it or not, AI is transforming the way we learn, way we work, way we conduct research, way we practice medicine. If we choose not to learn these tools today, we are merely delaying the inevitable. So let me begin. So I would like to know who's joining with us today. So please type in the chat where are you from and what is your designation, please. If I'll give you a few seconds so I can know who the audience is, so that I can tailor my talks like that. So welcome, Dr. Rohit Shah from Chennai. Okay, wonderful. So we have participants joining from different specialties as well. So today, the session is designed for every doctor, regardless of whether they have used previously or not. So we are going to do basics of AI. So a few quick points before we start. Please keep your questions coming. Yes, welcome Dr. Ilango Trichy from physician from Trichy. Keep your questions coming in the chat. I can pause after each major section to answer a few of your questions. If you're watching this from your mobile phone, don't worry. Everything that I demonstrate today can also be done from your phone. And thank you, Ashwini, for your warm welcome, for the kind words. So for those who don't know me, I'm Dr. Arun VG. I'll not go into the details. I think Ashwini has given me a very good introduction. Okay, so I'll go on to the learning objectives. So um, my objective of this talk at the end of the session, I would like you to be able to see what is AI, why AI, what is AI, how to use AI, what tool to use, and when to use, and what are the problems with AI. I'll also show some live demonstrations as well. So so AI is just a tool. Your clinical judgment makes the difference. So the million dollar question is whether AI will replace doctors. The simplest answer is no, it will not replace doctors. I'll tell you why and what is happening in the world of AI. So before I go into the further details, we all know AI is everywhere. Everywhere it is being used. How about in medicine? Are we using it in medicine or not? So I'm going to ask you another question. Who all have used AI today? Has everyone used AI today? Has anyone used AI today? If so, give a thumbs up in the chat box or you can tell the chat box. Okay. Yes, good. Okay, so AI is everywhere. It is in your daily life. Do you use Google Maps? Do you watch Netflix? Do you use Amazon? Do you use any banking softwares, UPI? Congratulations, you have used artificial intelligence. So Google Maps predicts traffic, Netflix predicts what you will watch, Amazon predicts what you purchase, and banks predict frauds before they even happen. So the face ID on your phone, that is AI, and X-ray imaging and your smartwatches, Apple watches, and everything is AI. So you're already using AI. Now it is time to become an AI-enabled doctor. Okay. So have you used ChatGPT at least once? How many of you have used ChatGPT? I think almost everyone have used ChatGPT at least once. Yes, every day. So yes, me too. I use ChatGPT every day. So the other question is, are you using these AI tools for patient care, teaching, or research? All good. I think Roj sir can join me in teaching AI to all these people, I think. Okay. Anyway, sir, welcome. So AI is healthcare is changing and AI is becoming unavoidable in these terms. Okay. So the gap is exactly where we are here today. So AI is probably the biggest technological shift in medicine since the internet. Question is no longer whether AI will enter healthcare, it is already has. The real question is whether we as doctors are going to lead the change or be left behind. Okay. So why AI? So healthcare is changing, as I told you. So if you look at the medical knowledge that is available, so if you look at the amount of knowledge that is coming in, so about 20, 30 years back, the time taken for the medical knowledge to double approximately was more than 50 years. Then it became 10 years, 7 years, 3 years. Today, the amount of medical knowledge that is available today will change in 73 days. So it is getting doubled. Almost more than 5,000 plus research articles is published every day. So to put it simply, how many papers did you read this week? Let's say 5, 10, 20. So this is which is not enough. There is almost 5,000 plus articles that has been published today. So one article, so we are already lagging behind what is happening in the world. So whatever you graduate, let's say a medical doctor or an MBBS doctor who is graduating today, within 3 months, he is going to be outdated. So we have to evolve, and we have to keep reading every day. So is it possible to keep up with this? So even if you read every paper 1 hour, you will still fall behind. The problem is not laziness with doctors. It is problem is mathematics. This is simply too much of information that becomes the burnout. Nearly 1 out of 2 physicians report symptoms of burnout. Either they are exhausted, they have sleep deprivation, lack of motivation, and fatigue due to the documentation process. And many doctors spend time with computers rather than doctors. So if for every 1 hour of patient care, we spend 2 hours for patient care, for paperwork. So let's look at everyday life. Every consultation now is becoming, it involves multiple diseases, multiple drugs, multiple investigations, multiple guidelines, multiple insurance requirements, multiple documentation systems, referral letters, insurance form, discharge summaries, medical certificates, follow-up notes. It is exhausting. So none of these improve our clinical reasoning, yet they consume a more enormous amount of time. This administrative overload contributes to the physician burnout, and that burnout affects patient care eventually. It affects communication, it affects the decision making, it affects empathy, and even our personal relationships as well. Our patients are becoming more and more complex. Instead of treating patients with hypertension, now we are treating patients with hypertension, diabetes, CKD, heart failure, obesity, sleep apnea, fatty liver, and depression, all in one patient. One patient, eight diseases, 15 medications, three guidelines, all has to be done within a 10-minute consultation period. So no wonder doctors, as we are overwhelmed. So if the amount of information is increasing while the amount of time stays 24 hours, we have to borrow 1 hour from the next day. So either there are only two options. Either the doctors work longer and longer, or the doctors become smarter. That is where AI comes in. AI helps us work smarter. So I've told you why doctors need AI. So now the main question is, what is AI? What is basically is AI? So anyone? So most of us think AI, ChatGPT is AI. So ChatGPT is just a small pebble in AI. Okay. So it is not interchangeably used. ChatGPT and AI is not interchangeably used. It is just a small part of AI. So let's look at the hierarchy of AI. Okay. So if someone tells artificial intelligence, chat GPT, and everything is same, it is like telling a medical college, a medicine department, cardiology, ECG, everything is same. So we know it is not related. It is definitely not the same. Let us simplify this. So now, artificial intelligence simply means, or one person started asking a question, can computers think? So that is where the basis of AI started. His name is Mr. Alan Turing. So he's a US gentleman who asked this question, whether AI or computers can think like human beings. So this gave up to the field of artificial intelligence. Do anyone know when the field of artificial intelligence was introduced? We feel artificial intelligence is today, yesterday, and today, or it is something about the future. No, artificial intelligence started way back in 1971. That is when Alan Turing asked this question. Okay, so now, so artificial intelligence is basically a broad term. Inside that, there is machine learning, deep learning, and generative AI. Machine learning is basically nothing, basically, it recognizes patterns. We have a set data or a sensor, like some sensor. Um, so in this sensor, what happens is, let's take an example of the ECG machine that we have in all practices. Okay, so you have in your clinic or in your hospital, and when you take a 12 lead ECG, it tells you it's an abnormal ECG, or it tells you inferior wall MI or anterior wall MI. How does it tell? It is not connected to the internet, right? It is not connected to internet. It is not connected to anything. You just plug in, you take an ECG, and it tells you it is an abnormal ECG or it could be an MI. So that is where the machine learning comes in. So what happens is machine learning is there are set rules that is there. So if there is a rule, it follows it. If the rule satisfies, let's say the ST segment is 1 millimeter below or above, it considers as ST elevation. Okay, so that is the rule. If it is the same line of the if it is same about the isometric line, it becomes negative. So when it goes below or above, it becomes positive. So that is what the ECG machines predict. Okay, so basically what happens is from millions of data they learn. So that is the machine learns explicitly, and the computer has that rule. If that rule satisfies, it is positive. So to put it in a simpler way, so automatic cars. So when you go at a certain speed, the gear increases, or when you come down on the certain speed, it goes down. So that is the rule that we are talking about. Okay. The next is the deep learning. So the deep learning is similar to what we have the neural networks in our brain. So it is artificial neural networks. So the important idea is that it has multiple layers. The computer learns through these multiple layers and identifying complex patterns. So imagine if you're diagnosing a patient, you don't jump onto diagnosis. First, they tell you patient he has fever for 3 days, then it's the cough started, running nose, cough, and things like that. And then you examine, you hear crackles, and do an X-ray, which there is a consolidation. Only then you finally conclude it as pneumonia. So deep learning works similarly. So each layer extracts a meaningful information like cough and fever. Then comes the crackles. Then comes the X-ray, where we diagnose a pneumonia. So generative AI, now this is the latest. So generative AI, so ChatGPT is a part of generative AI. Claude is part of generative AI. Gemini is part of generative AI. Notebook LM is a part of generative AI. So what happens is it can generate text, videos, presentation, music, computer code, patient education leaflets, research materials, summarize your discharge summary, or even the entire lectures as well. So now we have understood. I think hopefully I'm clear about what the hierarchy of AI is. Okay. So if you have any questions, let's take questions from this, and then we can go ahead and do the next section. Okay. So hope everyone has understood what is the hierarchy of AI. Let's look at how AI has evolved. Okay. How exactly ChatGPT works. Okay. So let's say, for example, if you ask ChatGPT, how do I treat hypertension? What do you think happens? Does it go and search Google? Does it open the Harrison textbook? Or does it secretly call another doctor? So definitely not. So what is actually happening is it is very simple. ChatGPT predicts the most likely next word. Nothing more, nothing less. One word after another. So for example, let's say I've given an example here, a 24-year-old athlete. Okay, I'll put it in a simpler way. So patient presented with severe chest dash. Can you someone fill the dash? A patient presented with severe chest dash. The most common answer is pain. So you have predicted exactly. So Dr. Rohit has predicted pain. So that is what ChatGPT does. It predicts the next word. So when you go and search in Google or go and search in ChatGPT, it predicts the next word, and it goes on and on and on until it comes to a final conclusion. Okay. So now, the how ChatGPT works is there are 5 steps to it. Okay. So step one is the prompt. It is the most important part of your ChatGPT search, or it is the most important part of this learning process. Whatever prompt you give, it is um, directly proportional to the response. If you give a good prompt, it will give you a good output. If you give garbage, it will give you garbage only. Okay. So you don't go and ask, how do I treat hypertension? So you have to be specific on what you're going to ask ChatGPT. Okay. Let's say when I put this prompt, a 24-year-old athlete presents with exertional syncope, echo shows asymmetrical septal hypertrophy. The likely diagnosis is, can someone tell what the diagnosis is? A 24-year-old athlete, exertional syncope, asymmetrical septal hypertrophy in echo. So, okay. So I'll tell you the diagnosis. The diagnosis is hypertensive cardiomyopathy. Sorry, hypertrophic cardiomyopathy. So everything starts with a prompt. Okay. So if let's say the chat GPT gives in, so once the diagnosis is when you know the diagnosis, so if you go into once the prompt is put in, what it does is it divides into tokens. It's like a Lego blocks. So what happens here is, so it does not read the full words, or it does not, chat GPT does not read the whole sentences. It breaks into tokens. So if you, it splits the words into smaller pieces. So if you look at the tokens, example of tokens, so there you can see subwords like cardi, omayo, and upati. So that similarly, each AI tool takes it in a different way. It can be any forms. It can be 3-letter words, 4-letter words, 5-letter words. It is different for each and everything. So that is what the tokens means. So then what happens is, so next is this transformation. So or transformer. So now it comes the breakthrough. One of the important things in AI forever is the transformer. When you read a sentence, let's say, as I told you previously, patient presented to you with fever, cough, chest, and running nose. So do you listen to each and every word? So you predict certain things. So if you take this example, a 24-year-old athlete, exertional syncope, and asymmetrical septal hypertrophy, what do you think is the important words for us? Or which words immediately stand out for us to come to a diagnosis? Young adult, athlete, exertional syncope, asymmetrical septal hypertrophy. So these are the important keywords. That is what it does. So it transforms these keywords, and your brain instantly recognizes these words, right? So that is what the transformer does. Instead of reading one word at a time, it looks at the whole sentence, understand the relationship between all these words simultaneously. Then comes the attention. So attention is, so we do not say, as I told you, each word does not carry equal importance. So some words like a and year old, presence with. So those are all unimportant words when you take this example. Okay. So ChatGPT does the same thing as well. It gives greater attention to the words that matter the most and ignores certain words, like how we do when we do a case or history taking in our outpatient setting. Okay. And finally, the prediction. So finally, it understands the whole thing, whole prompt, and it is broken into tokens and connect the relationships and identify these important words. And then the final task is your prediction, and then it responds. So it generates a response. So the possible response that it's going to give is hypertensive, hypertrophic cardiomyopathy. So this is what it does. So instead of it calculating so it calculates the highest probability of what is coming next among millions of possible words, and the highest probability is hypertrophic. Then the next prediction comes in cardiomyopathy. So then the word, and then next goes on and on and on, 100 times over, and every second, until the answer is complete. So okay. So this is what is how the chat GPT works. Now, the important thing is, how do we prompt? The single most important skill for AI, using AI effectively, is this prompts. So the better the prompt, the better the response. So let's say you can open your chat GPT and type in, tell me some about diabetes. So what happens here? So if you give you this prompt, it will give you a very vague, generic response, which is clinically useless. So it's a one-star prompt, which is a bad prompt. So now I'm going to improvise on this. Summarize the latest guidelines for type 2 diabetes management in adults. So it is a better prompt. Okay. So it will give you a focused, but still lacks the specificity on your context. So this is a two-star prompt, which is a good enough prompt, but it is not the perfect one. So now act as an endocrinologist, summarize the ADA 2026 guidelines for a type 2 diabetes with a 55-year-old with stage 3 CKD, HbA1c of 8.1, focus on SGLT2 inhibitors and GLP-1 receptor agonist, and use the table format for drug dose, renal adjustments, and key evidence. So we are specific what we want, and everything has been summarized in this prompt. So it will give you a more specific, actionable, clinically tailored prompt. So this is a three-star prompt, and it's a perfect prompt or an excellent prompt. So this is what the prompt is. Okay. So how do we prompt it? So I've just put in as a craft framework. So the mnemonic is craft. The first is the context. So what is a context? Basically, provide the clinical background. Okay. So the craft is, you don't have to put it in the same order. You can put it in any order by any means. Okay. And ChatGPT will pick up on it. So the clinical background is a 65-year-old male, post STEMI, ejection fraction of 35%. So this is the context of the patient. And what is the role of ChatGPT? So to act as a consultant cardiologist. So define the role as a physician, as a diabetologist, whatever you want. So that is the role of the ChatGPT. And ask specific questions. Create a medical reconciliation plan. So that is what is the specific ask from us. And a format. So specify the desired format that you want. You want it as a table, you want it as a PPT, you want it uh, as a letter, as recommendations to something. So you have to tell what format you need and the tone of the sentence. So how specific you want it to be. So if you want it to be used, you wanted to use the ESC 2025 guidelines, set boundaries and specific guidelines. You can, when you give, it will give you a more better prompt. So this is how you are going to do a prompt: context, role, ask, format, and tone. Okay. So now, a practical tool, AI tools every doctor should know. So what are the practical tools that every doctor should know? So we all know ChatGPT. So knowing the tools is not important. More important thing is when to use these tools. So when to use these tools? ChatGPT, when do you want to use ChatGPT? So it is when you want to generate a content, you want to have a differential diagnosis, you want a patient handouts or patient information sheets, you want discharge summary for documentation purposes, you use ChatGPT. And when do you use Gemini? So when you use Gemini for evidence-based search to summarize these guidelines and patient education material. Claude will give you a large, long document analysis, upload the full guidelines, research papers, discharge summaries. It can give you PowerPoint presentations as well. When you come to Perplexity, it will give you an AI-powered search with citations, quick evidence, lookup with source verifications as well. So Notebook LLM. So in Notebook LLM, Notebook LM, what we do is you upload what document you have, and then it will give you only specific things. So ChatGPT will generate from everything that is available in the internet. But Notebook LM will give you details of what you have uploaded in the upload section. Okay, I'll show you how it is going to work. Okay, and when it comes to medical specific AI tools, consensus is one important thing, and elicit and consensus, these are the best things for research. If you want a research assistant, you need to use these two: and open evidence, Amboss AI, up to date AI, and Doximity AI. So these are some of the tools which are medical specific AI tools. So let's go into, so I'll get out of my PPT, and I have some prompts. Okay, I'm going to show you some of the prompts. So now, okay. So before going to that, so I'm going to I'm going to classify my prompts and clinical tasks into these 5 categories: patient assessment, documentation, patient care, research, and education. So patient assessment, so let's see how the patient assessment we are going to do. Okay, so clinical decision. So I'm going to ask the chat GPT to act as an endocrinologist, a 58-year-old man with type 2 diabetes, stage 3 CKD, with an EGFR of 42, hypertensive, and a BMI of 33. His HbA1c is 8.6. And I'm asking the chat GPT to summarize the current ADA KDIGO guidelines and suggest evidence-based next treatment plans and present it with a table. So what format is it? It's a table format with drug advantages, renal considerations, contraindications, and key evidence, and asking it to not to fabricate any references. Okay, so I'm going to paste this prompt in. Okay. So I'm going to paste this prompt in ChatGPT. I've already done this. Okay. So same prompt. So it is summarized. Clinical scenario: 58-year-old diabetic, hypertensive, stage 3 CKD, obesity, and so current ADA guidelines. What does it tell? So we have to continue metformin because the AGFR is less than 40, more than 45. So only if it has to be done when it can. We have to stop metformin if the EGFR is less than 30. So it is asking us to initiate an SGLT2 inhibitors until the EGFR goes and till the patient has an EGFR more than 20, and the glycemic targets, which are, if the glycemic targets is not achieved, then it's asking us to go to GLP-1 agonist. So optimize the blood pressure with ACE inhibitors or ARBs when albuminuria is present. Consider fenrenone if there is persistent albuminuria. Okay, so it has given me evidence-based treatment options: metformin, first line, empagliflozin, SGLT2 inhibitors, semaglutide, dulaglutide, tirzepatide, and fenrenone. So it has given me advantages, renal considerations, contraindications, and key evidences. You can go and click onto that and see the exact evidence that is being produced here. So and practical next steps that we asked him. So priority to ensure maximally tolerated ARBC inhibitors or ARB dose, start an SGLT2 inhibitors, add on a GLP-1 later, and persistent albuminuria, consider fenrenone, and avoid hypoglycemic risk, high hypoglycemic risk agents that are there because of the renal functions. Insulin later, if he needed, go on to insulin. So these are the trials that is supporting the current practice. So it has given me a overview of how we are going to treat this patient. Okay. So now I want a discharge summary. We're going to the second demo. I'm going to do a discharge summary. It's a 72-year-old lady who's come with community acquired pneumonia and known case of COPD, diabetes, admitted for 6 days, received IV antibiotics, improved clinically, now ready for discharge. So diagnosis, I've not written diagnosis and things like that. So I'm just giving it the prompt: community acquired pneumonia, COPD, diabetes, IV ceftriaxone, nebulization, oxygen, improved afebrile, SpO2 of 96, follow up after 1 week. So the prompt exactly is to prepare a professional hospital discharge summary using these notes. Include diagnosis, hospital course, discharge medications, follow-up advice, warning symptoms, and write in a professional medical language. So I'm going to paste this in front of you, and a ChatGPT is going to create a discharge summary for me. So we can add the date of the admission and date of discharge, total length of stay. If you want MR number and things like that, you can add it. So what is the reason for admission? What is the hospital course? What is the condition of discharge? What are the discharge medications and follow-up advice, warning symptoms? Everything has been given. So you just have to copy paste this so that your discharge summary is ready. So this is how you use ChatGPT for simplifying your work and things like that. Okay, now next section is the patient education. So I'm going to ask ChatGPT to explain hypertension to a patient and avoid medical jargon. Use simple English, maximum 300 words. Include diet, exercise, salt retention, home BP monitoring, and red flag signs. So I'm going to paste this prompt here, and I'm going to see what it gives me. Okay. So now understanding blood pressure it's giving me in simpler English what we can give to a handout as a handout to the patients. Okay. Now I'm asking it to translate this into Tamil. So now I'm going to give a prompt to translate it to Tamil. Now it is going to give me everything in Tamil as well. So you don't have to do anything. Just give what you want, and you can make changes. You have to read and then make changes accordingly, so that when before we hand out, we have to be careful and before giving it. You know why? Because ChatGPT itself tells ChatGPT can make mistakes. Okay, so we have to be careful. So we cannot escape from medical counsel. ChatGPT will escape. At the end of the day, it is your reputation that is going to be affected and not ChatGPT's. OpenAI is not going to do anything. So if you want to interpret an ECG, upload an ECG and see what it does. And if you ask them to provide rate, rhythm, axis, intervals, and other things, it will give you. I don't have an ECG picture, so I will skip this. And now let's come to the differential diagnosis. So a 34-year-old woman with fever, arthralgia, malar rash, polyarthrite, proteinuria. So I'm asking it to generate differential diagnosis, rank them by the likelihood, explain why, and suggest further investigations, and mention some of the important red flag signs. So this is the prompt that I'm going to give to ChatGPT. Okay. So now it has given me, so first differential diagnosis, SLE, it has ranked it as well. So why it is likely, okay, so because of fever, inflammatory joint pain, butterfly rash, proteinuria, highly characteristic of SLE. So, and ANCA-associated vasculitis, it has given me 7 differential diagnoses, and most likely one is SLE. And it is recommended some blood tests to confirm our diagnosis, autoimmune investigations, infectious evaluation, renal assessment, and red flag signs. So it is given as a given and summary as well. So based on the available information, SLE with possible lupus nephritis is the leading diagnosis. Confirmation requires clinical correlation and immunological testing. So with all these tests. So this is what you can ask ChatGPT to give differential diagnosis as well. Okay, next thing is I'm going to show you something about medical research. So I'm going to show you, okay. Now I'm going to ask ChatGPT. So this I've already done. Okay. So I'm asking ChatGPT to suggest some topics for thesis for a general medical postgraduate. So let's consider myself as a postgraduate MD doing MD, and I'm asking it to suggest some of the topics. Okay, so that is all the prompt that I'm giving. I'm not going into specifics of what I want, because I don't know where I stand, what systemic topic I want. So I want to explore things. So I've just given a very simple prompt. So it has given me clinically relevant, feasible within 2 to 3 years, have adequate patient numbers, require limited funding, and likely lead to publications, and addresses the current gaps in data. So it has given me different from in diabetes and endocrinology, cardiology, infectious disease, nephrology, pulmonology, rheumatology, neurology, gastro, hematology, and critical care, even emerging AI and digital topics as well. Okay, so this is particularly suitable for a South Indian tertiary care center where tropical medicine, fever, and AKI is common, diabetes is common, sepsis is common, and cardiology. You can do premature CAD and lipoprotein A as well. So, and it has suggested some of the topics which has high publication potential, and these are the 8 topics that it is going to give. Okay. Now I've taken one of the topics, association between HbA1c and severity of diabetic foot ulcers. Okay. So this is a topic I've taken. So I'm asking it to convert to PICO and give me alternate hypothesis. So PICO is basically population, intervention, comparison, and outcome. So thesis topic. So it has altered the thesis topic a little bit. Association between HbA1c and severity of diabetic foot ulcers in patients with type 2 diabetes mellitus. The PICO format is population is adults with type 2 diabetes presenting with diabetic foot. Intervention I is intervention with poor high glycemic control, comparison with good glycemic control, and the outcome is the severity of diabetic foot ulcers. So based on the Wagner's classification, University of Texas classification, and PEDIS score. Okay, so now the peak of question is, what is the research question? Among patients with type 2 diabetes having diabetic foot ulcers, does poor glycemic control compared with good glycemic control lead to increased severity of diabetic ulcers? This is the question that we are going, that is our research is based on. Okay, and it has given me alternate hypothesis and null hypothesis as well, and it has gone further ahead and given me the objectives. So what are the primary objectives and what are the secondary objectives? And it has given me variables as well. What are the independent variables? What are the dependent variables? What are the confounding factors? And it has suggested a study design as well. It has given me a hospital-based cross-sectional analytical study, so which would be simplest and most feasible design. Okay. So now I asked one of the postgraduates from Salem to give me their topic, and I'm going to ask ChatGPT now. So this is his topic. So systemic immune inflammation index in correlation with increased carotid medial thickness in patients with hypertension. So this is his topic. I'm asking it to write the PICO and find out the research gap and the research question. Okay. So now the proposed thesis topic, it has changed the process. The correlation of SII with carotid intimal media thickness in patients with essential hypertension. So this is an emerging novel publication worthy topic, and it has given me the PICO format, PICO question, research, primary research question, alternate research question, hypothesis, and the research gap. And there is so the research gap is limited data in hypertensive population. There is a lot of data in CAD, ischemic strokes, and other things. So we don't have data in hypertensive patients. So this is one important thing that it has recognized as the research gap. And lack of Indian data, need for cost-effective markers, because SII just needs a CBC to be done, whereas when you go into carotid intimal media thickness, you need a Doppler study, so which is going to be costly. And absence of cutoff values, there is no universally accepted SII threshold. So these are the some of the research gap that it has from. So it has given me the problem statement, the objectives, primary and secondary objectives, and has given me 5-star rating for a publication potential. And it is suggested what journals I need to choose as well. Okay, so this is about um, research in ChatGPT. Let's go to Claude now. So what happens in Claude here? So when you go to Claude, there is something called projects here. So if you look at it, there is a projects here. I've clicked on the projects. So I've already created a project where it is written it as thesis to 2026. So I'm a postgraduate of general medicine where I have to do a thesis. Okay. And I've given an instruction to ChatGPT as well. So I'm working on my thesis on SII in correlation with increased carotid media interthickness in patients with hypertension. I'm asking it to act as my thesis guide, evidence ethics committee member, and the head of the Department of General Medicine, guiding me in crafting a research proposal that is academically rigorous, clearly identifies the research gaps, presents a compelling problem statement, and meet top university standards. So this is the instruction that I've given. So now I've got almost 13 papers that I've uploaded, so that I've got from the postgraduate, and I've uploaded in this. So now what happens when I do this? Okay, so now I've asked ChatGPT to start with the literature review on the SI in this topic, and can you put together a starting point for me? So this is what my question is to ChatGPT. So what it has done is it has gone through all the references, all the 13 papers that I have uploaded, and then looked into the facts, and it's given me a literature review starter. Okay, so it is a starting point that is given me. So it has given me a research question. So hypertension is a major problem, information and driven cardiovascular problem. So it is a very good topic. But so when you look at the um, okay. So it is now what it has done is it has suggested a narrative structure for the thesis. Okay, so section A, burden and definition of hypertension. So now what is the burden of hypertension, and it is defining hypertension. And for that, it is asking me to use these references and find out and write the thesis for this section. From hypertension to vascular damage. Section is from hypertension to vascular damage. What is the mechanism? And it is asking me to look at these references. And in section 3, subclinical measuring subclinical disease with CIMT. And this is the reference that it want me to look at. And section 4, the exposure. Now it is exposing the SII and where it came from. And these are the two references. And where the convergence of SII and CIMT happens in hypertension with these references. Okay. And where the gaps and the fields that go next is So it has given me the list of citations, what is the role on the review, and what it gives me. So all 13 has been reviewed, and it has given me what the whole paper tells me, and it has given me what it gives you, and what where I stand with this paper or with the uploaded paper for my thesis. And so it has given me a sample synthesis of the paragraph as well. And so it is given me gaps. So what is the gaps in the current set? So current set means it whatever 13 articles that I've uploaded, this is it is find out it is finding me gaps that is there. Okay, so in the other primary SI and CMT studies, to show whether the association replicates, and SII and hypertension, it's given me broad topics where I have to go and work more and more, and it has given me a starting point. So it is, if you look into this, when you go and sorry, so if you go and do a research where let's say 5 years, 10 years down the line back, what we would have done, we would have gone into PubMed and searched for articles, downloaded those articles, read the abstract, and we would still be left with whether this study is relevant to us or not. So ChatGPT and Claude is going to take over that work. Almost 6 months of data collection, literature search is going to be reduced to within few weeks. Okay, and it's giving me the practical next steps. So this is what I'm not going to the deeper about what how to do a literature review or literature search with consensus and other things, other elicit and other things as well. I'll go into that details when and the following webinars that come later. So now I just want to show you something about Notebook LM. So this is Notebook LM. So I've uploaded my PPT here. So what I've done for presentation last month. So AI for your medical research. So the practical tools for AI and medical research and academic writing. So when you look at Notebook LM, it has three columns. Okay, so one is your sources. You can add any sources here. You can upload files. You can upload even YouTube videos to summarize. You can from the drive you can directly give. And if you have text that has been discussed with yourself and your thesis guide, just go and upload it here. So once you upload it, Notebook LM will only look into this uploaded source. It will not go into any of the papers or publications that is already been done that is available in the internet. It will not go into that. Okay. One interesting thing about Notebook LM is this mind map. Okay. So if you look at this the third one is the studio, where you can have an audio overview or a video overview, slide deck. It will even create a new set of slides as well. And I've already generated a mind map. So what is mind map basically? So if you look at mind map, so this I've done. So AI for medical research and academic writing. So when I presented this PPT, I spoke about what is the history of AI. So history of AI. So early decades from 1950 to 2000, what happened? As I was telling about the Alan Turing and the birth of AI, Eliza chatbot, expert systems, Deep Blue, IBM's first networks, and modern revolutions. What is happening now? Deep learning to ChatGPT and the basics of AI. Okay, what are the core concepts as like what we were discussing about AI mimicking intelligence, machine learning, deep learning, generative AI, and what are the learning methods, whether it is supervised, unsupervised, and other things. And I've given a 6-step plan as well. So how to search smarter, how to read faster, and everything. So this is what mind map does. So when you want to hide certain things, so it gives you, so when you want to create a suspense about what is coming next, a mind map is the best tool that you have. And even if you want to have a quiz about this, if you upload your one chapter of Harrison's and ask it to generate a quiz, it will generate a quiz. It will generate a quiz and it will give you say like this. So it will give you questions and answers as well. So what happens, what are the first step, what is the second step? You can go on answering these questions as well. So this is what Notebook LM does. Okay, hope I'm clear. If any questions in the live demonstrations that we want to look at? Okay, I think I'm not done with the live demonstrations. Next is the soap note. You know what is soap note? Or if, let's say, okay, we don't want to go about that. So next we'll go to the Viva preparations. So I'm asking ChatGPT to act as an examiner. Okay. So I'm going to ask ChatGPT to act as an examiner and ask 10 Viva questions on diabetic DKA, increase difficulty gradually, wait for my answer before giving the next question. So now I'm going to paste this prompt. So now, so it is telling me, so what is defined? So include your answer, basic questions. If you go on answering on each and every question, it'll say I'm answering it as one. I'm not read the whole question. It'll give you the second question. Okay, and the question by question it will go on and on and on. Okay, so this is usually is very helpful for exam preparation. Okay, this is it's nice to see. It can help you as an assistant for you for exam preparation and everything. Now coming to the interesting point, so I'm asking ChatGPT to create not ChatGPT, I'm gonna create a PowerPoint slides. It can be done by Claude. So for time purposes, because it takes a longer period of time. Now my colleague wanted me to create a PowerPoint presentation for hemolytic uremic syndrome. So I've given a prompt to generate PPT for UG teaching, describe the etiology, pathogenesis, clinical features, diagnosis, management, and complications of HUS in 20 slides. Okay, let me download it. Okay, so if you see, it has given me hemolytic uremic syndrome, etiology, pathogenesis. It can give me a beautiful presentation. It has generated a PPT. It is very useful. You can just go and present the things. So again, I'm telling you, ChatGPT and Claude does not have anything to lose. It is your credibility that you are going to lose. So you have to look into it. You have to read in each and every statement and then come back to it. I think there's a question from Dr. Rohit Shah. Can we use Notebook LM for PPT? Yes, sir. Yes, you can use Notebook LM for PPT. I think I can show you the PPT that is I've already generated. But what happens is here it will not go and search the whole data. It will search only what you have given in the sources. So this is the PPT that is generated. So it is from the history of this thing. You can download it. So again, artificial intelligence, machine intelligence, deep generative AI. So how you can do supervised, unsupervised, difference between ChatGPT and Notebook LM, defining the scope, mapping the themes with elicit and consensus, how you can do with Research Rabbit, what to do with Claude, what to do with ChatGPT. This is the PowerPoint that I've generated. Okay. Again, this is one important integrity boundary. So use it for brainstorming. Use AI for brainstorming. Do not write your whole thesis or your whole manuscript from scratch. It will fabricate citations. I'll tell you. I'll be talking about the risk and limitations of AI in few minutes. Okay. Let me see. I think I've finished with the live demonstrations. Let me go back to my slides. Okay. Now coming back to hospital practice, how it is going to be helpful in my hospital. So far we have covered how AI can help individual doctors. What is AI? Why AI? How can you use AI? How to use AI and which tools to use for which purposes. Okay. So now how about hospitals? So I've got spoken about individual doctors. Now hospitals. Imagine walking into your hospital tomorrow morning. Before you see the first patient, AI has already done a lot of work. It has analyzed the today's appointment list. It has identified the high risk patients. It has flagged the abnormal results, prepared a summary of yesterday's admissions, and prioritized the patients who need urgent attention. So this is what AI can do today. Many hospitals around the world are using AI exactly in this way. Okay, it can simplify your work. Okay, so now we'll quickly see where all it can be done. So if you go into the outpatient department, AI can help you with appointment, scheduling, documentation, and patient education. Like I showed you, handouts can be prepared immediately. If you want to generate an handout for patients, I can even generate it now. And when you go to the ER, so it can prioritize. It has triage. It can triage your patients and keep ready. You can go directly to the red zone and then pay who needs priority basis, the treatment on a priority basis, so that we can save the patient as soon as possible. And when it comes to radiology, it is already, AI is being used in many of the centers for detecting lung nodules, for minor fractures, strokes, intracranial hemorrhages, and it is helping radiologists very beautifully. And in the laboratories, it can automatically detect the abnormal results, and it can look at the trends of what is happening with, let's say, if there is a patient with AKI, what is happening with the creatinine, what is happening with the urea levels, what is happening with the bicarbonate levels, what is happening with the CRP, what is happening with the total counts and everything. So that we can alert the clinicians if the renal functions are going the wrong way. We can go and treat those patients accordingly. In ICU, AI continuously monitors thousands of data points, identify the risk patients at risk of sepsis or clinical deteriorations even before the signs appear. Okay, subtle signs can be detected by AI, and then it can improvise how we are going to um, predict this and then treat patients accordingly. Okay, even hospital administrators are using AI to optimize bed management, reducing the waiting times, forecast patient volumes, and improve operational efficacy. Not only this, so not only this, see, even our Tamil Nadu government is using AI. So if you would have seen our ministers telling that there are lots of complaints that are pouring in, and they're using AI to triage that. So once they are triaged, they go and attend to the most serious issues first, and then the later ones. So every small issue is being attended by an AI. So everywhere, every walk of life you go to outside today, everywhere, everyone is using AI. We as doctors should not be left behind. So we have to use AI effectively as well. Okay. So notice something important. So that is, I've said, see, AI is supporting healthcare professionals and not replacing them. It automates the repetitive tasks, analyzes the large amount of data, and highlights the important information. The final decision is always with your healthcare team, with the doctors, with the hospital owners. So, okay. So now I want to talk about the risks and limitations of AI. Okay. So what happens with AI? So let me tell you a true story. Okay, one of my colleagues wanted references for a presentation on obesity. Instead of searching the PubMed, he asked ChatGPT. Okay, within seconds, ChatGPT generated a beautifully formatted references with author names, journal names, volume numbers, page numbers. Everything looked perfect. But when you look and go and search it in PubMed, none of these articles existed. These references look authentic, but they were fabricated. That is why every doctor using AI must understand this important principle. AI can sound confident, even when it is wrong. This is the biggest risk, and the most common limitation of AI is called hallucinations. It can fabricate. AI hallucination is very common, very common. Hallucination simply see, it means it generates information even if it's false. Okay, see, unlike human, when we sit in viva, if the if our examiner asks a question, if a examiner asks a question, what we tell, if we don't know the answer, we tell I don't know. But instead of telling I don't know, Chat GPT will sound like like most likely answer, and it will give you in a most convincing way, even if it is wrong. So never confuse confidence with correctiveness. AI will speak fluently. It does not guarantee accuracy. Next is a bias. So see, when we learn something, whatever we treat is based on what we are learned. Exactly, ChatGPT also does the same. If the ChatGPT has learned from some biased data, it will give you a biased answer only. So this is what important thing is. Or AI learns from the data that is being trained on. If the training data contains bias, it will automatically produce bias. Okay, so imagine an AI model trained to predominantly using data from Western population. Okay, can we use the same recommendation in Indian patient? So there is differences in genetics, disease prevalence, diet, social economic status, and everything. So AI reflects on the data that it learns from, but it does not understand the local context. That is where we as doctors are important here. Privacy and confidentiality. Today, data is the new oil. Data is money. So privacy is very, very, very important. Look, be careful about what you are going to enter into ChatGPT. Simple question. Would you upload your patient's medical records onto Facebook? Of course not, right? Same thing applies to AI platforms as well. Do not upload any identifiable patient information into AI public platforms. Instead of writing Mr. Ravi Kumar, 58-year-old with a hospital number 123456, right? 58-year-old with diabetic CKD and other things. Okay. So please remove, as a rule, please remove patient names, hospital numbers, phone numbers, addresses, date of birth, photographs. Please do not put it in AI. So next thing is the automation bias. So this is one of the most dangerous risk. How many of you blindly follow Google Maps? Okay. So we have a lot of times we believe Google Maps only to realize that it took us to the wrong road. Okay. So because we see we didn't drive into the lake, right? So why does it happen? We trusted the technology, but more than that, it is our own judgment that is required. So this is what is called as automation bias. So when you put it in the medical perspective, if let's say AI suggests viral fever and you think it has viral fever, if we stop thinking and simply accept the answer, we are going to miss malaria, dengue, leptospira, sepsis, and other autoimmune conditions. So the danger isn't AI making mistakes, it is ultimately the doctor stop thinking. Again, I'm going to tell you, it is not ChatGPT's reputation that is going to go, it is your reputation that will be hampered. So AI should support your thinking and it should not replace it. Clinical judgment is always superior to whatever AI gives. Accountability is with yourself. You are legally responsible. The software is not, the computer is not, the AI is not. It is the doctor. You cannot go and tell in the medical council that a chat GPT told me to do this. I'm not responsible. No one is going to accept that. And misinformation, as I told you, hallucination is again another thing, is also misinformation. Okay. So responsible AI in medicine, never upload patient identifiers, always verify the outputs. AI should assist, doctor decides. Doctor has the authority, hierarchy of AI, doctor sits on top. Humans is never remains accountable, follow the regulations, whether it is institutional, national, and data protection laws, please do follow the regulations. Okay. Before I give you the take-home messages, I think I'll give 2-3 minutes time for you to, if there is any questions, we'll take questions. I'll just have a sip of water and I'll come back. I think this Sindhil Kumaran sir has asked how to prevent noise over data. Sir, what do you mean by noise over data, sir? Can you be more specific? Prabhakar, you want to take over?
Yeah, sure, sir.
I'll come back in a minute. So I'll stop sharing my screen. I'll ask the team to take over for now, and I'll come back with my closing statements.
Good evening, everyone. Welcome to the world of MedWish. And this is our MedZig, the South India's most actionable healthcare summit, brought to you through MedTalks. The business of healthcare, nobody teaches this in medical school. What we are going to see here is everything you are going to watch is about MedWish. Now in its second edition, one venue, two days, September 26th and 27th at Sri Varalakshmi Mahal, Salem. 4 things are going to happen here, all under one umbrella. And I'll walk you through exactly what it is and where to go for each one. First, we'll go to Medverse Expo. Last year, we have achieved 120 plus exhibitor stalls, 3,500 plus doctors, 5,000 plus visitors walk through that floor. And this year, we are targeting 200 plus stalls, 7,000 plus doctors, and 10,000 plus visitors. That trajectory is exactly why earlier commitment gets you a better position on that floor. If you want to be a part of that flow, either as an exhibitor with a stall or as a sponsor backing the event, both are open right now. Feel free to click on the link shared in your chat box to book a stall or become a sponsor. Next, we'll look into Med Talks. What is it? Med Talks is a conference. Unlike CME, this is not a clinic, there is no clinical hours or pathology slides. It is built around one theme, the 3F, funnel, funding, and future, to help your business grow more than you expect. What is a funnel? It consists of a practical strategies on how to funnel through for patient acquisition, admission, and repetitive care. The funding. It consists of how to raise, structure, and deploy funds for hospital expansion. Finally, the future. It explains all about the technology, policy, and market shifts that will that will shape the healthcare over the next 5 years. If you run a hospital, small, medium, or scaling, this is where the business decisions are actually made. Click on the link. I'm going to share it in your chat box to register for weekly sessions. Register once, get notified for every upcoming webinar with the direct link to your phone. Now for the innovators in the room, this is MedPitch. More than 500 startups will be registered and curated through a hackathon process. From that pool, the top 25 will be selected to pitch their ideas live at Medverse. Every pitch gets validated in front of doctors and investors. There you will receive a real clinical feedback and real funding conversations. And the top 3 don't just win an award. They will have a genuine direct connection to the buyers and investors who are actively looking to fund in healthcare innovations. If you are building something in healthcare, this is the room you want to be in. Click the link in the chat box to register for hackathon process. And then comes the night that brings all together, the Oscars of healthcare, the pinnacle of healthcare excellence. We have 27 award categories recognizing hospitals, startups, marketers, and healthcare leaders across South India. The night closes with the celebratory networking dinner on September 26th, right here at Sri Varalakshmi Mahal. A chance to celebrate the industry's best and to network with the people shaping healthcare across the region. Nominations are open now. Both self and third-party nominations are accepted. Click the link in your chat box to nominate yourself or your friends and family members. So you want to attend the delegate. Here we go. If you want to attend a single day, the delegate pass is 599. Full access to the day session. If you want the complete experience, the full conference pass is 999. Both days, full access, including the networking dinner. And if you want the elevated experience with a premium kit, that's a premium delicate pass at 2,999. And it's just a couple of consulting charges. However, the experience you're going to get is immeasurable. Whichever level makes sense for you. The link is in the chat box. Register today because seats are already filling fast. Arun sir, thank you.
Thank you, Prabhakar. So I just want to leave you today with some few key take-home messages. AI will not replace doctors, but it will transform how medicine is practiced. Doctors who will use AI will outperform, and you will be replaced with doctors who use AI. Learn AI, start today, pick one tool, try it this week, build it from there. Practice AI. Prompt engineering improves with each and every interaction. Use AI responsibly, always verify. AI will never replace compassion. AI will never hold a patient's hand. AI will never comfort a grieving family. AI will never replace clinical wisdom. But a doctor who understands AI will probably replace the one who doesn't. Learn it, use it, lead it, because the future of medicine won't be built by AI, but it will be built by doctors who know how to use AI. One thing I want to leave you with today's session is don't ask which is the best AI tool, ask which is the best AI tool for this particular task. That's how experienced clinician think about investigations. What investigations you need for this condition. Likewise, what AI tool you need for this condition is what. So thank you so much. If there's any questions, we'll take it. Again, for the question Sandil Kumaran sir asked, sir, basically, to reduce the noise, you have to clean, filter, and structure the patient data before it is processed by AI, sir. So, provide only clinically relevant information such as symptoms, history, and other things. Use AI as a decision support tool. So, keep the data clean by removing the duplicates, outdated ones, unnecessary patient information. Focus on relevant details and provide only what is needed instead of the entire medical history. Thank you so much. Thank you, Raghavendra sir. Thank you for your response. Anything, if anyone wants to, any questions and any comments, you can unmute and then give your comment as well. If anyone wants to add anything, we can add. Vetrivel sir, welcome. Sir, எப்படி இருக்கீங்க?
நல்லா இருக்கு சார், நல்லா இருக்கு. It's an excellent program. It's an
Thank you.
excellent program. Everybody has to attend such type of innovative methodology in the healthcare delivery. I am very happy to congratulate Dr. Arun sir to disseminate the knowledge on AI, which most of us not fully aware about what is happening in AI world. Thank you, sir.
Thank you so much, sir. Thank you, sir. Thank you, sir. Thank you so much. If there's no questions, we'll finish the webinar.
I personally thank you all for joining today's webinar and making it a good success. Sir, we also appreciate your time, participation, and thoughtful engagement. And Arun sir, you were so wonderful. You gave us so much of knowledge on it. Really a wonderful session, sir. An engaging session it was.
Thank you. Thank you so much. Thank you
Thank
thank
you,
you for
everyone.
everyone. Thank you, everyone.